Hey everyone, welcome to the 1 in 5. Adam Renshaw here. I'm with Julie Poole today, who is a registered nurse, but she's also the site manager for Bighorn Valley Health Center in Hardin, which is quite the job, and we're going to talk a little bit about that today. And Rebecca Mussetter is my co-host today. Rebecca, it's been too long. Exactly, and it's really great to have you here. Abel is not here. You probably have noticed his absence. He is at a week-long festival in Alaska, and God knows what they're doing there. So if you want to wish him well, go ahead and just send us an email at the 1 in 5 podcast at iCloud.com, and I'll make sure that doesn't get to him. But Julie's here, and we wanted to talk about a few things. We wanted to talk about your entrance into healthcare and how you got started in this business, and why we should listen to anything that you say.
All right.
Okay.
I don't know if I can make that proof, but I will do my best.
Earlier, I said, why should we listen to anything you say? And she said, you shouldn't. And so I was hoping for a replay of that, but it didn't happen. But before we do that, I have a couple of trivia questions for you.
All right.
So I was thinking, what should we do with Julie Poole, a.k.a. Jill Pohl, a.k.a. Judith Loop?
I was going to say, I think you guys should be forthright and say that you used to share an office.
Yes.
Okay, yes.
Yes, it was one of the best times of my life.
Except
the ball.
I used to throw a ball against the wall. It was a creative thing for me.
Against multiple walls. And it was a creative thing, and it did help him think, yes.
So,
it was legit.
I'm thankful for Julie's understanding.
But nonetheless annoying, yes.
About that, yes.
Yeah.
But there would be looks sometimes, typically when she was on the phone, but I would try to be considerate.
Sometimes the balls would disappear.
And that was back when we were on the
time.
previous EHR.
Mm-hmm. Yes.
What was that called? The
E-Clinical Works.
E-Clinical.
Yeah.
And you were consistently on the phone.
Yes.
Dealing with issues around that. And so
Very
I would
much.
really try to be careful. Okay, Julie, I know she's talking about E-Clinical Works right now. So yeah, we used to share an office, which was actually an apartment building, and so that was a lot of fun.
Yeah, right on the alley there.
But I did mention your numerous nicknames too.
Yes.
Do you want to tell us how you got the name Judith Loop?
Well, Judith Loop came from our friend Kara Francis, who was kind of interning with us. And we have a specific provider that we currently work with and worked with at the time that could not remember my name, although we have known each other for multiple years. We worked together in a previous life. And called me Judy, kept calling me Judy. Is it Judy? It's Judy. So Kara grabbed onto that and started calling me Judith Loop.
And you even had a name badge that said
she
so.
had a name badge made. And I do still have that as well because that's just...
That name badge is still in the office.
Is it really? Mm-hmm. Oh, that's hilarious.
And when I first met Julie, I just thought Julie Poole sounded a lot like Jill Pohl.
Yes.
Who is a character in The Silver Chair.
Yep.
And so I called you Jill Pohl.
Yep. And that was at a time before Adam worked with us, and like literally days before Adam worked with us. And we had this exchange where he called me Jill Pohl, and I went back to work thinking, this guy was just awesome. You know, I had no idea who he was, and somebody handed me a resume. This is a guy we're thinking about hiring, and literally that's exactly how it happened. I missed his interview because I don't even know why I missed the interview.
Because you were dealing with a phone call from E-Clinical Works.
Probably, without the ball being thrown. But, I just said, I just had this encounter with this great guy that had nothing to do with work. And then, here's a resume of this guy, and it was like, that's him.
And you were like, hire him now.
Yes.
So for my benefit, when was that?
2016.
When did the dream team unite?
I came on in 2016 in May.
Yeah.
So it's been over 4 years since I've been here, but you've been here probably 18 months longer than that.
September of 2014.
So even more
I
than
started.
that, like
September
20 months.
22nd, I believe.
Almost
Yeah.
2 years.
And
Yeah.
did you start as our site director in Hardin?
I started in, the purpose of them hiring me was to get PCMH, patient-centered medical home recognition. And so I started off just kind of getting to know the clinic and working in the clinic as a nurse. And then about 6 months into that, I was just full-blown working on PCMH. And we took about 3 months, but we were able to pull everything together and got PCMH recognition within a year of my being there.
That's a huge accomplishment.
And can you explain why that's important, Julie?
Patient-centered medical home is exactly what it sounds like. It's the patient is in the center of their medical care. Rather than the patient going to this provider and having to communicate what their last provider just told them and trying to make sense of it all, the patient-centered medical home gives them one place where all of their care originates. And it is patient-centered. It's not provider-centered or nurse-centered or, laboratory-centered. It is everything becomes about the patient.
Awesome.
Yeah.
Awesome. And so Bighorn Valley Health Center is a patient-centered medical home.
That is accurate.
Interesting.
Yeah.
What about all of our other clinics?
Everyone is patient-centered, recognized now.
Terrific. Great question, Rebecca. Thanks for asking that. So I want to get into this trivia. I have heard from somebody that you are someone who has frequented in the past Emerald City Comic-Con.
I have been there a couple times, yes.
A couple times.
Mhm.
Okay. Yeah, I remember you showing me some autographed
Yeah.
pictures of you and certain celebrities. And so I did have some questions
All right.
about, some trivia questions about sort of comic booky, actor
All right.
type stuff. You think you in?
Let's go.
You can do this?
You know
Okay.
it. I'll make up something if I don't
Okay,
know
we'll
it.
start with an easy one. Which of these superheroes was created by Marvel? Superman, The Flash, Firestorm, Spider-Man.
Spider-Man.
Good. Did you see how quick that was? I mean,
Boom.
that was ridiculous.
Most recently played by Tom Holland.
Okay.
Also Andrew Garfield, and
Oh.
prior to that,
Toby.
Tobey Maguire.
Tony Maguire?
Tony.
Tony.
Yeah, it's kind of like Julie.
Look at this.
Judith.
Okay,
Yeah. Marvel's my thing.
okay. Let's switch over to DC then.
Oh, crud.
What is the name of Superman's alter ego?
Clark Kent.
Jeez, can't pull
With
anything
glasses.
past this one. Okay,
Hold on. I'm
here
putting on
comes
my alter ego.
Rebecca Kent. Oh, and Julie Kent.
And now you have no idea who we are.
We're masked.
I know.
We're masked superheroes.
Isn't-
Best disguise
What
ever.
about Bizarro?
What about Bizarro, Julie?
What about Bizarro?
She did say that DC's not her thing.
Yeah.
Wouldn't he be an alter ego as well, since he's the exact
Oh,
opposite?
gotcha.
Right,
In
that's
Bizarro
right.
World, yes.
Okay, here's one.
Okay.
In which of these movies was Carl Urban not in? Lord of the Rings, The Two Towers, Star Trek Into Darkness, The Chronicles of Riddick, The Bourne Supremacy.
I have not seen the last two. I know he was in the first two. I'm going to go with The Bourne Supremacy.
He was actually in all four of those.
Oh.
That was a tricksy one.
Okay, that was a trick. Yeah.
So-
no, I knew he was in the first two.
I thought
And
you were a huge Carl Urban fan, and that would be an easy one for you.
Yeah, we totally called you out on that.
You did. I do have a picture and an autograph with.
I
with
know,
Mr.
that's
Urban.
why I remember that picture. I remember you showed me after you got back.
But yeah, I was all about bones.
Bones.
Which, if you
that's
don't
right.
know, he has bones, but that is his name in Star Trek.
Jim, I'm a doctor.
A word from our censors. The editor of the 1 in 5, Abel, would like to apologize for Adam's use of the word blank. For those wondering what word Adam used, it sounds similar to wham it. Our 36.5 person Censorship Committee at the 1 in 5 has deemed this word offensive. The 1 in 5 editor, Abel, has been asked to use the obligatory bleep tone during Adam's little indiscretion, along with the following message written formally with hints of litigious undertones for the sake of our viewers. We at the 1 in 5 podcast do not condone any use of the word blank. According to paragraph 13 of section 8.4 in the unofficial pod and vodcasting censorship manual, the word blank, which sounds like wham it, is listed as offensive. The only permissible use of the word blank is when the directive damn it is being used in the context of holding back or obstructing the flow of a liquid.
Yes.
Not a whatever. Okay.
All right, your corn-fed mind.
What is the name of the superhero team that has these 4 members? Sue Storm, Ben Grimm, Reed Richards, and Johnny Storm. Johnny and Sue are brother and sister, so that you know.
Well, I'm gonna.
There's 4 of them.
Fantastic Four.
They're pretty fabulous.
Fabulous Four.
Nice. The Fantastic
Fantastic Four.
Good.
That was total guess.
Okay.
I had no idea.
You knew it. You had it. Okay.
It was the Storms that gave it away.
The Storms, the 2 Storm brothers and sister. Okay, last one. If you could meet one of these superhero actors, who would it be? Chris Hemsworth, Ben Affleck, Robert Downey Jr., or Tom Hiddleston?
Robert Downey Jr., hands down.
Really?
Oh, 100%. Tony Stark. Tom Hiddleston, though, was just boom, right close.
I thought for sure, I threw Tom Hiddleston in there because I thought for sure you would pick him.
Yeah, and not because I don't love him, but Tony Stark. And not just Tony Stark. I mean, Robert Downey Jr. forever. I think I've seen every movie he's ever been in.
She stumped you, too.
She stumped me.
There you go.
Well, that was good.
But I have seen, and I think in part because I haven't seen Tom Hiddleston in as many movies.
Okay.
I have seen the one where he was a country singer. Now I can't think of the name, but yeah.
I haven't seen that one.
But yeah, Chaplin.
I did just watch The Night Manager. Have you seen that?
I have not.
With Tom Hiddleston.
I saw The Light.
The Light.
I saw The Light.
Oh, that's it.
That's the one with Tom Hiddleston. Where
Okay.
He's the country singer, Hank Williams.
Oh, have you seen that?
And that he
No.
just does phenomenal.
Okay.
I'm not a country music fan, but I am, Hank Williams, Tom Hiddleston.
For some
that
reason,
was
I
good.
thought you had sort of a weird, celebrity crush on Tom Hiddleston.
Yeah, I don't know if I'd call it weird, but
Okay.
but yeah, much
What
more.
would you call it, Rebecca?
Totally acceptable.
Yeah.
Awesome. Well, why don't you let's. I hope that was fun.
That
I
was
hope that was
really fun.
fun for you. I hope that was fun for everyone. And
I just want to say right now that Julie is one of my favorite people at Bighorn Valley Health Center because not in addition to being a nurse, she has a background in health IT.
Yes.
Which is right up my alley, and also is a nerd for quality data, which is also right up my alley. So Julie's I'm a fan. If I could have a weird, what did you call it, a weird celebrity crush?
Yeah.
I have a weird colleague crush.
What about a
Wow.
totally acceptable colleague crush?
I hope that is totally acceptable.
That is awesome
We might have to
because
talk to HR.
yeah. But when Rebecca came, we did share that language. That was really good.
Yeah.
I started off as out of high school. I wanted to become a nurse, and there was a new program, and I became a medical assistant, and realized a couple years in that that's not what I needed to be. I wasn't able to do the things that a nurse could do, and it frustrated me. So I ended up getting out of clinical work, and that's how I got into working with computers. And I worked for the state of Montana for 15 years with the Board of Investments. And I was kind of an office manager, and the IT person was retiring. Interestingly enough, because he did not want to go to Windows 95. That was like his cutoff.
So he said he was done?
That was it, and that was the purpose of him retiring. And he was of age, he could retire, so he did that. And I jokingly said to my boss at the time, you should just offer it to me as a training assignment. And if I had thought he was going to take me seriously, I would have not ever had the guts to say that. But he did take me seriously and came in that afternoon and offered me that position. And so then 15 years I was a database administrator, network administrator, did a lot with data for that agency. And then my daughter graduated from high school, and I knew I needed to do something different with my life. So I went to nursing school and graduated from Carroll College in 2008. Worked in labor and delivery for a couple years, and then and worked at Crow for 4 years, the IHS hospital there, and then came to BVHC, and it's just the best place to work. And during that time, got a master's certificate in nursing informatics.
Wow.
Yeah.
I kind of have a celebrity totally acceptable.
Well, I feel like, for me, you're sort
Now.
of like the epitome of what we all have to do at nonprofits, which is wear many hats.
Yeah.
Yes.
Yeah.
Yes.
And currently the hat you wear most often when you're not covering for someone somewhere in the clinic is site director
Yes.
of not one, but two
Clinics now. Yes.
In the same city.
Two clinics in the same city, as well as somewhat, we've also got the annex, and then we've also got this building. So yeah, we're kind of spread out. So it's kind of hard keeping all my chicks in the same basket.
What building are we in right now?
This is the Public Health Building. We haven't come up with a BVHC name for it yet.
I've heard 809 bandied
That's right.
around.
That's- go to
the
809.
address, 809 Custer. Kind of like 515 over in Miles City.
And how far away is this from the campus building, our new clinic?
It's actually pretty close, isn't it?
It's about a 4.5 minute walk. I've timed it.
You've timed
obviously.
it.
Yes.
A 4.5 minute walk. How far of a walk is it over to the Wilson building, which is the old clinic?
About 8 minutes.
Yeah, I was going to say campus to
0.4.
Wilson is about 12 minutes for me.
Okay. Yep. Good job, Adam.
So we're getting our steps in now.
There we
Yes,
go.
absolutely.
I wanna
No, it's
segue
nice.
them.
I enjoy it. I enjoy when something comes up where I need to go to one of the other places to be able to just get that midday
Yeah.
walk in.
Yep.
So
It's also neat to reconnect with people that you don't see every day anymore.
I
When
know.
we could all fit in the same room and did that every morning, I think we felt a lot more connected. So I think it's important that we do get out so that
Agreed.
people are seeing our faces.
I stopped in and saw you this morning.
You did?
Which was really good. It was
Mm-hmm.
good to see other people, other staff members
Mm-hmm.
in that clinic that I haven't seen. I mean, COVID has thrown a wrench in
It really
everything.
has. It really has.
So
Yeah.
all the working from home and those types of things.
Well,
so
COVID threw a wrench in the grand opening of
Yeah.
the new clinic.
yes,
We did a
yes.
soft opening, right?
Mm-hmm.
What was that, 2 weeks ago now? 3 weeks?
No, we opened
July 6th.
July 6th.
Yes.
Yes.
So that was
Yes.
about 3 weeks ago,
3 weeks
right?
ago.
Yeah.
And so, we've all seen pictures of the clinic, and you guys had that awesome time-lapse video of it being constructed.
Mhm.
But,
Yeah.
I guess my question that I would want to know if I was watching this is, how does it feel to be working in that space?
It is so awesome because we're in a space that was meant to be a clinic, not an apartment building / dance studio / whatever else used
For
to be
sure.
in that
Yeah.
in the Wilson building.
Real estate
Real
office.
estate
I mean,
office.
the Wilson building, I think will always hold a special place in our hearts because it was our first. This is where we all met. This is where we became us. And but working in this clinic, and if you've been in the Wilson building and been cramped into that small little waiting room, when you come over to the campus building, it's just the waiting room goes on forever and ever, which is just awesome. And
Yeah, Rebecca likened it to an airport runway.
yes.
Terminal. I felt
Terminal.
like
Terminal.
That, yeah, sure.
I had two overwhelming sensations the first time I walked into that clinic building. And one was how, what you were calling out, how professional it felt to be inside that space. And the other was the light.
Yes, light. Yes. Every patient room has a skylight, so we've got that option for some sunlight there. We've got windows are all the way around the building. So one of the important things for us in designing this space was, when you walk into a bigger building and you have no idea which way you're facing, what's north, where's outside, where's the sky, what's it doing outside. So one of the things that was important to us was being able to, when you walk into a room, you still have some idea of where you are. You can see the sky, or if you're in the waiting room, you can see, the entire front is windows. Same thing in the back for staff. So you're not, you're kind of more anchored, I think, where you are when you can see what's going on outside.
So you've been a part of this process from the beginning. Can you just tell us a little bit about how that went, and maybe touch on some high points of of some things that took place during this, and maybe tell us a fun story, or a crazy story, a weird story. I'm sure there's been weird stuff that's happened along this process.
I'm sure there have. I cannot think of any of them now. I think some of the more fun things were they gave, and I know Dr. Mark, Ryan, myself, and I don't remember who else, got hard hats. The construction guys gave us hard hats and vests of our own. Mine is still in my car just in case I have a hard hat emergency.
Because you did so many tours.
Yes.
You were giving tours.
Giving tours, and then also they would have questions, where should this go? What should this be like? And so Ryan and I were over there a couple times a week answering those types of questions.
Wow.
So, yeah.
So, okay. I mean, that's kind of that was the thing that surprised me about the space, was how I felt when I walked into it, because I'm with you. Wilson Building is where I started at Bighorn Valley Health Center, so it's home to me as well. But, I always likened it to a rabbit warren. That's what it felt like to me. You got to make a left here and a right here and then a second right and then one more left and then go through that door, and then you're in the bullpen. And then if you take 3 more hard rights and then a left, you're in exam room 1. But don't go through the third door, go through the second door, because if you go through the second door, you're locked out.
You nailed it.
Yep.
That's it.
Yeah, and we call it a rat's maze. I mean, when we would bring people in for interviews, we'd take them through the halls and back to where the conference room was, and it's like, okay, now if you find your way out, you get the job.
Yeah, it's like, we did this just to disorient you.
Exactly.
Now go find your way out.
The real interview is you have to find your way out.
So, but from from a patient's perspective now, I guess that would sort of be my question is, now there's 2 clinics, because we haven't stopped providing services at the Wilson Building.
Correct.
So what's the difference? What kind of services are we offering at the new clinic versus the old clinic?
So starting Saturday, all Saturday appointments will now be at the campus building, which is the new building. We termed the campus building, we gave it that name because our plan is for that entire area to become kind of like a campus, a medical campus, but also dental. We want to be able to have services there for our patients, for our community. So starting Saturday, this coming Saturday, the Saturday appointments will be there, as will the late night appointments. So the campus building, the new building, will be open 8 to 8. And
Monday through Friday?
Monday through Friday. 8 to 8, Monday through Thursday.
Okay.
8 to 5 on Friday. We don't have late hours on Friday. And then Saturday, 10 to 2. And then at the Wilson building, which is the initial clinic site.
The original.
The OG. The OG clinic
the
site.
OG clinic. That will be 8 to 5, and those will mostly be same-day appointments. Okay. So for patients who woke up, I'm not feeling well this morning, or, last night I was a little bit sick, and they call in the morning and they get an appointment there. So those will be same-day appointments, and that's just to provide access for our patients.
Is that same day just for primary care or also for behavioral health?
Mostly primary care. We do warm handoffs, but which doesn't mean that somebody couldn't make a same-day appointment, but most of behavioral health will be at the campus building.
So does this affect, if a patient, let's say a patient has established care with a provider, is this going to affect, can they still see their same provider? Or is it going to be sort of a weird rotating door now?
Yes, they can still see their same provider. At the Wilson building, we have on Mondays will be Bonnie Oxford. Yeah, and having said that, that is not an accurate statement. So sorry about that. I do not have the same days memorized.
No, that's okay.
I was thinking the late nights, but no. But yes, so every mid-level provider, which is Bonnie Oxford, Katie Ketterling, Lisa Debus, Paul Murder, and Nicole Turns Plenty, they each have a same day at the Wilson building.
Okay.
And that's the part I can't remember which is which. But so if you need your annual exam or a physical, or, you want to spend some time talking with your provider, you're probably going to call the campus building and the phone number is the same, but you're going to make your appointment there at the campus building. Versus if you just woke up this morning, you'll be able to see in any of those providers, but you could, you may end up seeing your same provider as the same day.
Oh, okay.
Or you may not, just depending on who's on that
So
day.
it might be one of those sort of pleasant surprises.
Yes.
Like, hey, I woke up and I'm not feeling well. Oh, and I get to see Paul.
Yep.
So even though we've opened up a new clinic, if I want to see the same provider that I've always seen, I shouldn't have a problem scheduling an appointment.
That is correct. Yes. Yes. We
Okay.
have, we've really opened up access so that our patients will be able to get in to be seen almost always by who they want to be.
Right on.
So, same day visits, Wilson building,
Yep.
primary care visits, campus building,
Yep. And behavioral health,
campus building.
campus building.
Okay.
Yep.
Did the pharmacy move?
The pharmacy has not moved. So we are moving over in phases. And the pharmacy will be moving over with phase 2. And we don't have a time frame for that right now. That's,
Okay.
still very early, working on funding and things like that. But when that phase 2 opens, the pharmacy will be there, as will everything else BVHC.
Oh,
It
including
My understanding is with phase 2, that will be where all of BVHC is.
okay.
But I suspect that's years away. I don't have a time frame for that.
Okay. Why the huge waiting room? I know we talked about it a little before, but I know that there's a reason. Let's preface this by saying, if you've ever been to the Wilson building
Yeah.
and sat in that waiting room, you cannot 6-foot distance.
Exactly. And it was very important for us to not go back to that too small of a waiting room. So we did, some may say we overcompensated, but patients are happy with it. And especially at this time with COVID, it is really important that people be able to have that space to distance. So
Sure.
I like to think that
was
we're
a
going to
benefit.
grow to fill the space.
Yep, absolutely
Sure.
we will. Yeah.
Yeah. So, can you explain a little bit how it's set up? And I'm going to use my hands here, but there's like 3 lines. I view this building in like 3 lines: waiting room, patient rooms, provider space.
Yep,
Is that correct?
that's accurate. Yeah.
Okay, so patient rooms are in the middle of everything.
Yes. So we have the waiting room, and then there's 3 doors, and each of those go back to a set of rooms.
Okay.
And each goes back to four rooms, and then the providers and nursing staff are towards the back of the building, and that allows them to come up and not ever have to take a patient through, the bullpen or where the providers and nursing staff are. So it kind of keeps that separation while still making it feel like a big, one big area, as opposed to we've got all of these little areas all over the place. It's a very connected feeling.
So the patient rooms are in the middle of the building.
Mm-hmm.
We're literally,
Centered.
Yes.
it's a patient-centered building.
Very good.
You know where I'm going with this.
Yes, totally.
Yes, the patients are in the center.
So you've come full circle. You're back to be directing our patient-centered medical
There
home.
we go. Yep.
So what does a clinic like this mean to a rural area?
I think it means access. People can't get up to Billings or down to Sheridan, and often can't get into IHS when they need to. So I think the biggest thing that we offer them is access. But in addition to that, we take care of the whole patient. We are not just here to treat somebody's diabetes, because somebody who has diabetes can also have depression. So we want to make sure that we're getting that. But a patient who has diabetes, who's being abused at home, they're not focusing on what their blood sugars are today. They're focusing on being safe, or their kids being safe. So we have resources that can help people who are, whether it's domestic violence or they're having issues with their landlord. I once had a patient who their landlord had the water heater wasn't working, and they had a new baby at home, and the landlord refused to fix it. And at that time, we did not have resources. Today, we would have resources to be able to help that person.
Awesome.
Our clinic staff have received special training in screening for those kinds of issues
Exactly.
and finding ways to provide interventions.
Yes, and so that program is called PREPARE. I can't tell you exactly what PREPARE stands for, but
Protocol for responding to, and that's it. That's
there
all
you
I
go,
got.
and that's it.
Patients, assets, risks, and experiences.
There you go. Very
Wow,
good.
Good job.
We just did a podcast with Jessica Musseter a couple weeks ago, so.
And so basically that's the social determinants of health. So the social determinants of health are the things that do not happen in a medical office. There's about 10% of what we do in the clinic that affects somebody's health. The other things are, do they have a job? Do they have connections to people? Is there abuse at home? Do they have transportation? Do they have a faith community or something else where they get their spirituality taken care of and things like that. So that's 90% of what happens to someone's health. So focusing on, you need to take your blood pressure medication, that will help that person's blood pressure. But if you ignore everything else that's going on in their experience, you're not going to solve the problems.
I'm so glad you brought that up, because it just really affirms what Jessica was speaking about 2 weeks ago. On that previous podcast. So it's really important.
It is. It's huge.
And
it's
so
huge.
so this clinic provides access. So one of the things it's helping to do, and we've talked about this numerous times, is the transportation barrier, right? It's helping to reduce that transportation barrier.
Yes. But in addition to being local so that patients can come and see us, for patients who have to go up to Billings or somewhere else for a referral or to get additional health care, we do have opportunities, and I'm sure Jessica talked about this as well, but we have gas cards that we can give to patients so that they can make that trip and not have to worry about it, not have to worry about, well, yes, I can get up to Billings, but I can't buy groceries this week, things like that. We want to make sure that they're able to focus on the most important things to them, and then we can help support the other things.
For sure. Well, do you have any parting words for our listeners today? Any words of advice, wisdom, quotes, funny quips?
Well-behaved women seldom make history is my favorite quote. Those of you who know me will know why. But stay masked, stay safe, and be well.
Awesome.
Thank you so much, Julie.
Absolutely.
Awesome.
Thank you.
Yeah, thanks, guys.
Appreciate it.
And thanks, everyone, for joining us for this episode of the 1 in 5 podcast. If you would like to reach us with any questions, comments, any questions for Julie Poole, you can send them to the 1 in 5 podcast at iCloud.com. That's the number 1 in number 5 podcast at iCloud.com. And as Abel would say, have a rural, healthy day.
Awesome.